In this video, you will learn about diabetes mellitus. Insulin allows glucose to move into cells to make energy, and it inhibits glucagon activity. During fasting, its value is less than 100 mg per deciliter and glucose tolerance test is less than 140 mg per deciliter, and HbA1c value is less than 5.7%. Its physiology is whenever you eat food, it goes into the stomach, and if the blood does not utilize the already stored glucose in it, then pancreas release more insulin. Diabetes mellitus is a chronic disorder of carbohydrate, protein and fat metabolism resulting from insulin deficiency or abnormality in the use of insulin. This means that there is more amount of insulin in the body. Type 1 is known as insulin-dependent diabetes mellitus. It is an autoimmune and it is early introduction of cow's milk and cereals, intake of medicine during pregnancy, indoor smoking of family members, destruction of beta cells of the pancreas causes little or no insulin production, and this initiates the IDDM. It requires daily insulin administration and it may occur at any age. It usually appears below the age of 15 years. And that's all about type 1 diabetes. Type 2 is known as non-insulin dependent diabetes mellitus. It is probably caused by disturbance in insulin reception in the cells, decreased number of insulin receptors, loss of beta cell responsiveness to glucose leading to slow or decreased insulin release by the pancreas. This means that there is decreased number of receptors and decreased released by the pancreas. It occurs over the age of 40 but can occur in children. It is common in overweight or obese patients and with some circulatory insulin present often do not require insulin. What is pre-diabetes? It is impaired fasting glucose and its value is 100 to 125 mg per deciliter, and impaired glucose tolerance is 140 to 199 mg per deciliter. And meanwhile, the HbA1c value is 5.7 to 6.4%. Now come to the risk factors of diabetes mellitus, that are obesity, race, history of CVD, hypertension, physical inactivity, familial history, polycystic ovary syndrome, and gestational diabetes. These are the clinical manifestations, that means signs and symptoms of DM. The most important and common are polyuria, polydipsia, polyphagia, and then comes the weight loss, nausea, vomiting, changes in LOC, severe hyperglycemia, sleepiness, drowsiness that leads to coma, recurrent infections, prolonged wound healing, altered immune and inflammatory response, prone to infection. This means that glucose inhibits the phagocytic action of WBCs and this will lead to decreased resistance. Genital pruritus means hyperglycemia and glucosuria favor fungal growth in candidal infections, resulting in pruritus, common presenting symptom in women. Then comes weakness, fatigue, and increased blood sugar or glucose level in the body, and glucose presence in urine means glucosuria. These are all signs and symptoms of diabetes mellitus. We can diagnose it through glucometer, the diagnostic device for sugar. This is how we can test our glucose. Fasting plasma glucose tolerance test. No food or drink 8 to 12 hours prior to test. Then blood is drawn and tested for the level of glucose in the blood. High glucose level means potential diabetes. Second one is oral glucose tolerance test. In this, no food or drink 8 to 12 hours prior to test is taken and then drink glucose. Blood is tested 2 hours later. High glucose level means potential diabetes. And this is OGTT, oral glucose tolerance test. Here comes the glycosylated hemoglobin HbA1c. It is a test that measures the amount of glycated hemoglobin in your blood. Glycated hemoglobin is a substance in red blood cells that is formed when blood sugar attaches to hemoglobin. In this slide we can see that in red blood cell there is glucose and hemoglobin, and they both together will known as glycohemoglobin and function together as glycohemoglobin HbA1c. Then comes the urine analysis. This involves glycosuria and ketone bodies in the urine, and presence of these two indicate diabetes mellitus. The diagnostic criteria is classified as classical signs of hyperglycemia with CpG greater than or equals to 200 mg per deciliter. Oral glucose test is greater than or equals to 200 mg per deciliter. Fasting is equal to 126 mg per deciliter or may be greater, and A1C is greater than or equal to 6.5%. And this is the diabetes control card. Here are given HbA1c and mean blood glucose values that may be excellent, good, and these are also present in which action is suggested. Interventions for diabetes mellitus. Follow individualized meal plan and snacks as scheduled. Balanced diabetic diet: 50% carbohydrate, 30% fats, 20% CHON and vitamins and minerals. Diet based on patient size, weight, age, occupation and activity. Patient must have adequate carbohydrate intake to correspond to the time when insulin is most effective. Routine blood glucose testing before each meal and at bedtime is necessary during initial control, during illness and is unstable patients. Do not skip meals. Measure foods accurately. Do not estimate. Less added fat, fewer fatty foods and low cholesterol. Advise use of complex carbohydrates to maintain and stabilize the blood sugar level. Avoid concentrated sweets high in sugars that are jellies, jams, cakes and ice cream. If taking insulin, eat extra food before periods of vigorous exercise. Avoid periods of fasting and feasting. Keep weight at normal level. Obese diabetic should be on a strict weight control program and should lose weight. These are all interventions or diabetes mellitus, and I hope you like this video, so subscribe my channel. And thank you so much for watching this video.